Hello friends, welcome back to my channel Registered Nurse NAVPREET. I hope you all are doing well. So today we will be discussing regarding nursing interviews, questions and answers. So this video is gonna be useful for nursing students or the nurses who gonna freshly pass out and they're gonna prepare themselves for a job interview. So let's get started without wasting any. So the first question usually asked in interview is tell me about yourself. So you have to focus on introducing yourself. You will be talking regarding your nursing education, your skills and your qualities. If you have any outstanding achievements like any awards or certificates that you have received while studying or while your nursing job career, that you will be telling. Then, if I have to answer this question, I'd say myself, NAVPREET Kaur, and I am registered nurse in dash 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 nursing home, and I am currently working as a charge nurse for more than a year, and I have experience working with other team members from different departments. I always ensure my care is patient-centered and my patient gets high-quality care. I always ensure safety of my resident and I always give care within CNO set standards, or you will be talking about your regulatory body set standards according to your province. So the second question is, why did you want to be a nurse? This is a most common question that will be asked in an interview. So you will be talking about what strikes you to become a nurse. What happened all of a sudden that you think, oh, I am made for nursing? So you have to answer this question really smartly. So you will be talking regarding nursing as your passion. You will be telling that you like to care for people. You like to provide treatment, support, comfort, and education to a patient. You will also share your experience when you realize that you are made for nursing. So you can also give an example, what strikes you to become a nurse. So if I have to answer this question, I would say, so I like about nursing is that that nursing is my passion, right? So you will talk about nursing as a passion. So I'll say, when I was in 10th standard, my grandmother got a stroke, and when I went to see her in the hospital all the time, I see the nurses were caring for her, and they were so respectful, and they were providing care with so much dignity. They were always listening to our concerns. So that time I realized that I want to be a nurse because I'm always kind, helpful to each and everyone. So that's what struck me to become a nurse. And on top of that, I have passion about nursing. I like to care for people. I like to provide treatment, comfort, and support and education. I am knowledgeable and I like to share my knowledge with others. So that's how you will answer this question. This will definitely score you and also make you highlight as a candidate for a selection. So the third question they usually ask, what are your strengths and weaknesses? So in this question, you will be talking about your qualities like I'm honest, I have positive attitude, the desire to learn that will help you to learn new skills. Your leadership qualities, if you have, and that you are sharp-minded and you are critical thinker. Then in weaknesses, you can say I'm overcommitting and I overthink, I get overstressed, and sometimes I feel I need to slow down and trust my team. So if I have to answer this question, I would say my strengths are my honesty, my positive attitude. I have desire to learn that's why I prefer bedside learning to help me to gain new skills. I have leadership qualities. That's why I'm working as a charge nurse for more than a year. I know how to lead my team. I know how to prioritize resident and how to give care to my people. Then you can also talk about that I have critical thinking skills. I know whom to prioritize. Then the weaknesses, I am very overcommitting. Sometimes I feel like I need to slow down and trust my team. So the fourth question is, what you find rewarding about this job? So your answer should be revolving around working on the floor, gaining hands-on experience, teamwork. Ongoing learning skills are the best part about this job. Then you can also talk about teaching others and sharing your knowledge when you work as preceptor. You can also talk about continuing education and growth opportunities while working as a nurse. Last but not the least, like to offer helping hand to patients. So because your answer should be revolving around a patient, around a nurse. That will give a positive um, of impact on an interviewer. So if I have to answer this question, that what I find rewarding about my job. So I'll say I like bedside nursing and I like to work on the floor. I like to get hands-on experience and I am a good team player and I know how to work with team. Learning ongoing learning skills are the best part about my job. Teaching others and sharing my knowledge when I'm working as preceptor is best part of my job. Continue education and growth opportunities while working as a nurse. That's what I like about nursing. And I also like to offer helping hand to patient. That's why I find nursing as a rewarding job. So the fifth question is, what does patient care means for you? This question you will be answering regarding providing health services to those who are in need, suffering from medical issues. Focus on physical, emotional, and spiritual well-being of your resident because patient care involves all these aspects. Then you will be talking about addressing patient concern, meeting patient needs. You have to talk about listening and answering patient concerns because patient care involves listening and answering patient concerns. Then educating regarding diagnosis and treatment and discharge treating, that will also be included in patient care. So if I have to answer this question, I would say, according to me, patient care means providing health services to those who are in need, who are suffering from mental issues. My patient care will be focused on physical, emotional, and spiritual well-being of my patient. I will be addressing the patient concerns and try to meet the resident needs. My main aim is to listen and to answer patient concern. I will be educating regarding the diagnosis, treatment, and discharge planning to my patients. So my patient care would be patient-centered. It will be revolving around my patient. So next comes the question number 6. Explain any hardest decision that you made recently. As you can see in the picture is self-explanatory. It describes that you are in lots of stress. You are in state of conflict that what you have to do. So hardest decision, you will be talking about your nursing life, or if you never been working as a nurse, you can talk about your nursing school life. If nothing is available from the nursing perspective, you can talk about your personal life too. So then, if I have to answer this question, because the hardest decision sometimes I have to make being a charge nurse is that if my patient is sick and he's not eating good, and according on the palliative performance scale, he is only 4, then at that time we have to think about palliative care orders that are end of life care orders, right? So then I have to call the family member, asking them to make a patient palliative. So palliative means the patient is in lots of pain, not eating and drinking well, not doing great, like he is on the scale of 10, he is only getting 4 scores. So this is the time when you think about end of life care. So then you talk to the family. It's always the hardest decision that you are making. To keep your patient comfortable, you will be giving care according to the comfort. So then you will be talking to the family regarding the end of life orders. And trust me, this is the hardest part, and I have gone through this even during COVID, calling the families and talking to them and making them understand what does end of life means. It was a challenging. Yes, it was challenging. So I would try to explain, like my resident was not eating and drinking well from last 3 days, and then the palliative performance scale, he was only getting 4 out of 10. Then I called the nurse practitioner and try to discuss the situation. And then we made a agreement that okay, let's call the family according to end of life care orders. Then talking to the family and calling the doctor was the toughest decision for me, because it is hard to see the resident going, because palliative is introduced when you are saying okay, let the patient die. It's the end of life care orders and you are trying to keep the patient comfortable. So that was the hardest decision of my life. And you can always call about calling a family member or doctor regarding resident condition getting worse and offering palliative care. Decisions were hard. Resident was comfortable during the end of the life. So yeah. So next come seventh question. What are your future career goals and how this position will help you to achieve them? So in this question, my answer would revolve around to gain experience and skills to work as bedside nurse. Old age care homes to gain experience to get specialty certifications like gerontology. To gain experience to work as DOC, Assistant Director of Care, Executive Director, Resident Care Coordinator, or manager level position. So if I have to answer these questions, I would say uh, my future career goals are I would like to obtain bedside experience and I would like to enhance and sharpen my clinical skills. I would like to get experience with old age care people in your nursing home because I am looking forward to get specialty in gerontology. I am also looking forward to work as a director of care, assistant director of care, or resident care coordinator in future. So manager level positions. So that's why I am considering that this position is going to be so helpful for me to achieve my future goals. So so next question is the most commonly asked question in nursing interview is any mistake that you made and what you did after. So it's regarding talking about any error that you have done. So always make sure when you are answering this question, you are saying that, oh yes, I have done an error but you self-corrected it. So that will give a positive impact on the organization that is going to hire you. So you can talk about any error that you have done while collecting a lab specimen, any error that you have done while recording and reporting, any errors related to drug and dose administrations or drug and dose calculation. So if I have to answer this question, I would say yes. I have done an error while recording and reporting on a resident. So what I did, I went back to a patient chart. I create a straight line. I signed my initials there and I re-entered the recording and reporting. So this way my error got erased, right? So I try to correct my error. So this way that will give a positive impact. Okay, you have done an error and you have done something to remove that error. So you are self-correcting yourself. This is what they need, that you are self-correcting yourself. You are not hiding anything. You are not just keeping the errors in your mind and not improving it. So you have to say, I have done an error and I have done this to remove this. So next come question number 9. Being nurse is very stressful job. How will you handle it? So you can talk about bedside nursing, that it is very busy. The best way to avoid is organizing and prioritizing your task. Turn your knowledge into action. Among co-workers, stress avoided by open communication skills. Communicate to your colleagues and doctors. So the best way to avoid is keep calm, don't worry, be positive, take it easy, don't stress, enjoy life, and so on. So if I have to answer this question, I would say yes, I know bedside nursing is very busy, and the best way to avoid is organizing and prioritizing tasks. And I am a critical thinker. I have those skills to prioritize my task. This way, I don't feel stressful at my job. I know my priorities. I have the knowledge that I turn into action to solve the problem. I don't stress out. I know how to communicate with my coworkers, and if I'm in stress, I like to communicate with my colleagues and doctor as well, so that I don't stress about my job. And the knowledge sharing is great. Sometimes my coworkers might have the great ideas to deal with a certain situation, so I always involve the co-workers if the stress is there related to them. All right, so the next question is compassion is needed to be a nurse? So this question you can answer by involving the emotional aspect, compassionate care, feeling concerns, and empathy, respect, and dignity. So if I have to answer this question, I'll say yes, compassion is needed to be a nurse. I believe in compassionate care. I like to understand the emotional aspect of the resident. It is the feeling and the concern of the patient, and I like to understand the feeling and concern of the patient and treat those feelings with empathy, respect, and dignity. So that was all regarding today's video. This was part one. So just stay tuned for the next part. And also don't forget to subscribe my channel and please leave me a comment. What kind of videos would you like to watch in future? Thank you and you have a good day.